Hello, everyone. Thanks for finding your seats for our last plenary session of the day. Hopefully everyone had a meaningful and educational and engaging set of workshops and breakouts. Hopefully everybody met somebody new, created a new collaboration, made a new friend. That's the special thing about an event like this, is you have people who work in lots of different places but care about a lot of the same things. And to the extent that we can put those folks in the same room, we have the opportunity to create the change that we want to see. I am Dina Chisholm. I am the chairman of the board of the Health Policy Institute of Ohio. And I want to again thank you for spending your day with us. Thank you for sharing everything that you've shared with us through this time. Thank you for being a friend of HPIO. Invite you to continue being a friend of HPIO in all the ways that you can be a friend, attending our workshops, reading our documents, sharing our documents, even making donations if that's something that falls on your heart. That's one of the things she makes me say. We do this work because we care about it, but we need to have a broad community be part of us being able to make it happen. So that all being said, I am honored to be able to address and welcome our last panel of the day. We have two leaders from Ohio who are going to share some real wisdom with us. We hope that this session will inspire you and provide you with some additional tools that you can use in your work. So one of the things that many of you are aware of is that for the last decade or more, Ohio has experienced a higher than average, we'll put it that way, infant mortality rate. We have had performance that is among the worst in the United States as a state. And our black-white disparity has been as high as 3 times and remains a significant challenge. What we know is we've put a lot of time, energy, and money into this work over the past years, and we're seeing change. We're seeing progress, and the communities that have been tasked, who've been challenged with the greatest rates, have also put in a lot of time and energy to try to make a difference on that. And Cincinnati is one of those communities that has taken a lead in trying to make that change. So Cradle Cincinnati is a network of partners working to improve infant mortality rate in Cincinnati and Hamilton County. And it's been held up as a model for other communities across the state. And in fact, Governor DeWine recently announced Partners for Change Initiative, which is a funding source that's really designed to help translate some of the successes in Cincinnati to other counties with high infant mortality rates. What I want to say right now, though, is that this session is not just about infant mortality. We've done lots of sessions about infant mortality over the years, and I'm sure it'll be part of the session. But what we're really focusing on here is the unprecedented collaboration that the Cincinnati team has brought to the work that they've done. So it's really about how people from multiple sectors have partnered, shared data, and engaged community residents who are closest to the problem. So last year, Jill Miller, the president and CEO of BI3 Fund and one of the community partners that supports the work of Cradle Cincinnati, and Dr. Meredith Smith, the executive director of Cradle Cincinnati, wrote a book detailing the collective action that took place in Greater Cincinnati to bring about a meaningful improvement in infant mortality rates. And that book is titled Infant Mortality and Other Wicked Problems, a community-driven approach to creating change. I heard a rumor that there is a raffle, and you might get some bedtime reading if your name is called. So this book goes beyond talking about infant mortality and really lays out a blueprint for bringing communities together to address complex health and social needs. And it ends with the phrase, change is doable. And that's the mindset that we want everybody to leave this room with today. So we're happy to have Ms. Miller and Dr. Smith to talk to us today and help everyone understand how to tackle wicked problems. So a little bit of formal introduction. Jill Miller is the president and CEO of Bethesda Inc. and the BI3 Fund. Through her leadership, the BI3 Fund, one of Ohio's leading health grant makers, has awarded more than $105 million in grants to fuel health equity and innovation. She's passionate about leading the way to a day when every person has a fair and just opportunity to be as healthy as possible. Throughout her 2-decade career, Jill has worked in both the for-profit and not-for-profit sectors. She's a board member of HPIO, Philanthropy Ohio, and Bethesda Foundation. And in just 2 weeks, she'll be honored by the Cincinnati Acquirer as Woman of the Year. We are amongst royalty. Jill holds a business economics degree from Ohio's Miami University, an excellent institution that generates excellent graduates, maybe myself included, and also an MBA from Xavier University, which is okay too. So, Dr. Smith is the Executive Director of Cradle Cincinnati and Assistant Field Professor at the University of Cincinnati Medical School and the Founding Director of Queens Village. Dr. Smith received her PhD from the University of Cincinnati in Educational Studies and was formerly the Director of Women's and Black Studies at Northern Kentucky University. She applies her knowledge and passion beyond the classroom in efforts to build stronger, more equitable relationships to benefit the greater community. As Executive Director of Cradle Cincinnati, she brings together partners, community, and medical professionals to co-create sustainable solutions that increase equity, lift Black women's leadership, and lower infant mortality and disparities. She's a valued member of several boards of directors, including the National Board of Directors for Public Allies and the Advisory Council for Greenlight Fund Cincinnati. And with that, I give you our panel.
Thank you so much. And just a huge shout out to Amy and the HPIO team for putting all of this together. Tremendous job. And please give a round of applause to yourselves for hanging in there until the bitter end for this presentation. We've been known to be pretty entertaining, so hopefully we can deliver that today. No pressure. All right, I think I have slides.
After I turn on my mic, it's going to be great.
Yeah, there's the clicker.
Do I need to point it somewhere?
Is it on? Here, let me look at the side.
I am not a techie person.
Well, there's an on-off switch.
No, that works.
There you go.
Thanks, Amy.
You can't be good at everything.
Surprise my colleague Candace that I didn't turn it on. Oh, goodness. All right, so I'm going to go back and just start with, if you were just in the session for human-centered design, you heard the word wicked problem mentioned. And so what is a wicked problem? It is a problem with multiple, complex, often interconnected factors that are difficult to pinpoint and understand, much less resolve. So that can be intimidating. And so infant mortality is one example of a wicked problem. But I challenge you to think about what are the other wicked problems in your community, whether it's poverty or climate change or transportation or education. And they can be overwhelming. But we're here today to be a witness to change is doable. I may not be able to create change with the slides, but you want to try? All right.
Boom, nailed it.
We planned that, see, just to make you laugh. So let's start with what's in it for you. And what we hope you walk away with is a flexible framework that can help you think about your own challenges in your own communities. We're really going to focus in on building trust and centering those with lived experience to co-design solutions that work. And we have data to back this evidence up that when you do that, you create real change. Engaging in advocacy, so you can't just throw problems at wicked problems. You need programs and policy, advocacy, and partnerships to really move the needle on these problems. And then we'll leave you with some questions you can take back to your own teams and think about as an organization in terms of how you think about your advocacy work. So what this book provides is a flexible framework. This is not the solution. This is not the specific recipe you follow and will achieve whatever goal you set for yourselves. But what it is, and you can read it front to back, or you can jump into different chapters. But it's really just meant to help you think about these different things. And so where did we start? We started with the data. What was the data telling us? And then the data told us that infant mortality in Cincinnati across Hamilton County was one of the highest in the country relative to counties our size. And it had been for years, and that was unacceptable. The data could tell us that it was extreme preterm birth that was the leading cause of our infant mortality rate, followed by unsafe practices of sleep. So the data could tell us that women were not seeing their OB-GYN in the first 12 months of pregnancy. And those are so critical to get into care in that first 12 weeks, the first trimester, because they can see issues that can be addressed early on in pregnancy and provide care to moms in new ways. And so that early prenatal care, which meant appointments had to be open. So healthcare immediately said, all right, we just got to open more appointments and make sure that if a woman calls at 8 weeks and says she's pregnant, we need to get her in the next few weeks, not in 6 weeks. But it was deeper than that. So the data can tell you so much. And I think you start with the quantitative data, but it's the qualitative data that allows you to get to the root causes. Because when we went into Avondale, which had one of the highest infant mortality rates of the country at 18.9 babies were dying per 1,000 births. And we started with the moms, and yes, access to early prenatal care was one thing, but it ran deeper than that. They said that it's great if you open up appointments, but some of us can't get there. Because we have to rely on a bus, and the bus doesn't run on the same appointment schedule. And so I'm late for my appointment, and then my physician is upset with me and tells me that I don't care about my pregnancy because I'm late to my appointment. Transportation was a big issue. Lack of support. So the women said, we just don't feel like we have the support to help us. I don't know who to call to watch my child when I need to go on an interview. So it was these social drivers that we call them, and we had to create a model that wrapped around mom and baby and created a model that addresses not only their medical needs, but their social needs. We also learned from Black women that there was mistrust of the healthcare system, and for good reason. So my last remark about the data is let it guide you. Set a North Star and go after it, but then also develop those interim metrics so that you continue to make progress and can celebrate wins along the way. Challenging assumptions and getting to the root cause. We all bring assumptions to the table. We bring our own biases. And so when we're really listening, listen as if you know nothing about the problem, and let the people tell you about the problem that they're facing. Trying something new. Insanity is doing the same thing over and over again and expecting a different result. So we need new ideas to solve old problems. And then we scale what works. I like starting small and building out, which is what we did in this case. So don't be afraid to start small. And then create a narrative that inspires people to action. What is your message? And not only what is the message, but what can they do about it? And then building a movement, centering those closest to the problem, and co-designing solutions and engaging in advocacy. So Meredith and I are really going to dip deep in these last 3 bullets here, because I think that's going to be most meaningful for you and most helpful as you think about your own problems. Change is doable. We heard a lot today around the challenges that we're facing and the government cuts that are coming to fruition, but change is doable. So you can see that back in 2011, our infant mortality rate was 10.2 across Hamilton County. And you can see that as we deployed this new model of really engaging women, surrounding them with the supports they needed to get into early prenatal care sooner, we started to see a decline in infant mortality. But I want to put my finger on the bigger dip when we went from 8.1 to 5.5, because we started to really listen and engage Black women in 2018. And that's really when we started to make progress. So change is doable. In 2023, we hit the 5.5 infant mortality rate. What I will say about infant mortality rate and other wicked problems is you can't necessarily judge progress year to year, like with wicked problems. You're going to have some upticks. The line to success is not straight. And so there may be an uptick, and then you dig into why, and then you reset and you continue the good work that you're doing. So we did experience an uptick in 2024. But if you look back since we started this work in 2011, we have experienced a 30% decline in our infant mortality rate. So I'm going to I'm going to turn it over to my friend Meredith, just to talk about building trust and what that looks like.
Awesome. Thank you. I am going to keep it casual and in my seat. I did not choose comfortable footwear. And so lesson has been learned. Nonetheless, as we talk about trust, I think all of you are working on that. And so I want to come from a place of both learning and teaching and recognizing that you are doing this. So I am not like, surprise, trust is important. And you're like, yeah, duh. What I'm sharing is, what did we do to build a movement of Black women in Hamilton County that became thousands of Black women that got us to a 5.5 infant mortality rate? And hopefully there's something there you'll pick up and may be able to use. So what I start with is those who are really on board. So if you come out and you say, hey, Black babies are dying and I need you to jump in, and those folks who are the early adopters run in and they say, I'm in, you run with those folks. And people always ask, what about the people who are like, why are we focused on the Black women? What about the people who are like, where is the data to assume that we should do this? What about the people who are complaining? What are the people who are worried or scared or et cetera? Those people will come along, but they are not your focus. So you take your early adopters and you sprint, and you allow those early adopters and make the assumption, which can sometimes make out of you and me, but we make the assumption that those people are in community with people who are like-minded. And so community building is very simple. Queens Village started around my table with 10 Black women. Those Black women asked 3 Black women. Those 3 Black women asked 3 Black women, until we had thousands of Black women connecting monthly around the process. The biggest issue was you had to say, this is what we are going to do, and then I had to do it. The minute that you are going into the community and say, I'm listening, I'm giving the survey, I'm doing all the things, and then you don't, you are yet then another person who dips into my life and asks me for a thing that doesn't deliver. So in order for me to be able to do that, I call Jill Miller and I say, hi, Jill, this is Meredith. I'm just now getting into the public health work. I don't really know about infant mortality. However, I do know about Black women because that's where I've been. Last place I stopped was Miami, love and honor. She went to Miami. Can I have some money to talk to Black women about what they want, and then they're going to tell me what they want, and then I'm going to do it. So basically, I just need money to figure it out and then do it later. And then Jill was like, you just need me to give you millions of dollars, and you'll tell me about what you're going to do later. That is correct. And then she said yes, and here we are. So trust can begin in a very precocious relationship, right? So like, this is an example of what trust building looks like. the example of going into the community and asking Black women what they want, and also saying, honestly, I'm listening. I want you to dream as big as you can with no limits. And I also want you to know there are limits, right? Like Jill's not a billionaire who can be like, we're doing birthright trips to Senegal. But she can do a lot more than you think. So the creativity and the innovation became really serious and really important. So that is an example of building trust. I'll also say people are like, you go into hospitals and talk to doctors, they give you their data, they talk about data, they share their data publicly, like, tell me more. And I will say, who is one of our favorites, not that we have favorites, but Dr. Emily Miller's in the room, who is on our floor and is a neonatologist. And when I go to her and say things like, I have some questions about this housing voucher. We're going to get housing vouchers. If you are pregnant, you're going to get the housing voucher. You're going to get housing before you get finished being pregnant. 100 vouchers went out. And when that 100 were done, it was done. But I'm like, people are still unhoused and pregnant, so how can we keep going in this process? Dr. Miller, who is also saving babies and doing all the things and doing research and grants and holding research committees of people who don't go to meetings like me. And she's like asking the housing authority for the data so that we can get more information about getting more. And they won't give it to her. And we begged for years and talked to God, literally. And finally, she went to every partner who was in the work to grab the data to get what we need. That is the kind of commitment that hospitals, that doctors give to create trust with the community. I really believe you should be housed. And the work that I am doing, I believe that your SDOH is also important to your outcomes. So trust is everywhere, and people show up in every area and avenue. I think that's awesome to know, because the whole theme here is change is doable. But if you have policy that does not work, it ends it ends any intervention. So places like HBIO and this conference and this conversation, or any other work that you are doing around policy and advocacy in your government relation departments, are helping us sustain these innovations and creations. And I don't follow PowerPoints. So I love you, Jill. That was my trust building. Co-designing solutions. I think I gave the example just a second ago when I talked about the housing piece. Moms were like, I am unhoused, I am pregnant, and that is a stressor. Stressors relate to preterm birth. Preterm birth drives infant mortality, right? So a co-creation piece is, I need some way to get housed right now before this baby comes and the vouchers come. Then, you co-create a solution of how do we get enough data to get more vouchers? So you find your leaders in your medical space. And then you say, Jill's very connected, because when you have the money, people connect to you. So I'm like, Jill, can you ask so-and-so to do such and such? So the other piece is, use your people to co-create your intervention. Your most important people on co-creation, and I'm sure all, if not, hopefully all, at least when you walk away, all of you will know, if you have an infant mortality problem, and the problem is that Black infant mortality is 3.5 times the rate, the people most impacted by the problem are. So we are then going to ask them what they need and then do it. So what we think we know was clearly not working. So then we went to have new ideas. The thing that I think is interesting is that even me walking in a Black body doesn't have the experience of every Black woman in the Hamilton County, which people are like, well, you ought to know. I'm like, yeah, I'm one person with 2 babies. Like, let's get real. So when I started this Queens Village stuff around the table, I was all excited, and I was like, we're going to be Wakanda forever. We're going to be the Dora Milaje. And the Dora Milaje, like the Black women who are standing on the mountains and they're fighting and they're like, have the sword or whatever. And I was like, get me a shield. And so I'm like, so what do y'all think? And they're like, no, ma'am, we are not going to war. I would like to be a queen. What is going to be different in my life is how I am treated royally. Like, roll out the carpet, give me a catered meal, babysit my child, teach me how to paint, teach me how to yoga, give me tangible solutions to my stress. I was like, okay, this is why we listen to Black women. So like the example of that, another great example of co-creating a solution. I need more money. Economics is driving a problem. We live in America, things cost money. You don't have money, you don't get it, the end, right? That includes housing and lights and water and all the things. So Queens Village is sitting in the we're now spread and scaled in multiple places, and there are probably thousands of people. At this meeting, there were probably 92. So we're solving 90, 95, whatever, doesn't matter. We're trying to solve the economic issue around jobs. So we're like, there are lots of job opportunities, job creation places that'll help you get your interview. Like, what kind of job do you want? So we understood the problem. The team goes marching looking for job opportunities, and we go to CAA, which is a community action agency. I don't know, is that national? Doesn't matter. And they have a job readiness program for people who are in construction. We were like, bomb. These people are protected. They have a certain amount of money they're going to make. Like, they can't make a minimum less than $75. All the things seemed like the best idea. And they were willing to take a cohort of people in the Queens Village space and continue to fund that. And so we're also like, oh, it's funded. I don't have to look for money. It's glorious. We go back, we pitch it with our PowerPoint slide, and they're like, girl, ain't nobody going outside to do no construction in the winter, in the water, in the cold, in the heat. Like, and so I'm like, well, it's a great thing we didn't put any money or time into putting up this thing. They were like, what about healthcare? Like, it's in my heart, it's in my soul. It's where a lot of them have come because they've had babies and they've been in the system. And so it turns out that everyone, and one of them, a lot of folks even on our team who were on our board are now on our team. And I see them all over working at the hub. I think the hubs are in here, and CHWs and leading organizations around public health. So the joys of that are great. I'm going to give two more that are not, that are a little less Meredith needs to listen better, and a little more systems change in the co-creation. So one is the Queens Village boards meet monthly, and they are paid. We pay people for their time, no exceptions. And the Ohio Department of Medicaid says, I am going to have anybody who wants infant maternal dollars in Hamilton County to write their application to the Queens Village board. So when you write your application, normally you write it to the state, and you like write your formal thing that you throw through AI, because I know y'all all write through AI now, don't play. And you write it and you send it, and so now they're sending it to the Queens Village board. But if you are going to the Queens Village board, who has had an IMR that is abysmal for decades, and you say, I've been working on this problem for 30 years, they're like, you're probably not the one. So you start to have a very different relationship with the people you are serving. And you're like, oh, when they come to the door, you're not like, you're 15 minutes late. What is your problem? You're like, you're 15 minutes late. How can we solve that for you? It's shared power. It's shifted thinking. That's the kind of work that not only do we meet, love each other, not become the Dorlahe, become queens, not be in construction, but be in public health, but also change the way the state thinks about spending money on the solving of the problem. Or, thank you again to Jill from BI3 who funded this work. Hospitals, they were like, I feel fear, like Times Magazine or New York Times or whoever nationally is writing about babies are dying, black babies are dying, black moms are dying. And when I get pregnant, I'm like, is it me? Is it my baby? And instead of running to the doctor and telling the doctor that you're pregnant, which is crucial for preterm birth, you stay in your house scared out of your mind. And so what I knew was that hospitals are doing great work. Examples all across the county. So I went and I said, can we share your data on a website called Mama Certified so that people will know that you're doing great work? And basically they said no. And then I said, but what we will never do is weaponize data or demonize you for anything that you are doing. What we want to do is talk about the good things that you are doing and create change in what you are not doing well. And we will badge you on what you are changing versus on what you are failing on. Because as we know, yelling at people is not a solution. Especially people with power. They're like, oh, I see that you're upset, but I'm going to continue to do the same thing. And then who gonna check me, boo? No one, right? So that is crucial to know. How you talk to people in power is necessary. You need to light a fire in people and not light people on fire. That is not a solution. So that is co-designing, and I think I did. Oh, look, see, Jill, to be very clear, I did not read that. I did not even look at that. I did look at it like in my heart. And she nailed it. We nailed it. We are the best team. Thank you.
You didn't see me try to pull it up. So yes, I nailed it.
Oh, did you struggle with your Okay.
So a couple of things you hit on. One is I don't want you to leave this room thinking that you need a BI3 to do this work. Because I will tell you, when the Cradle Cincinnati first started off, and it started because of our former Hamilton County Commissioner, Todd Portune, put the flag in the ground and said, it is unacceptable that too many babies are dying in Hamilton County and things are going to change. And then he gathered the right champions. He tapped Dr. James Greenberg, who is a neonatologist at Cincinnati Children's, and he tapped Elizabeth Kelly at UC, who is an obstetrician who knows this work inside and out. And he said, the two of you are going to help us change the outcomes for babies in this community. And then they raised $1 million across our community from foundations and corporations, and the city of Cincinnati put funding towards it, and Hamilton County put funding towards it, to be able to create Cradle Cincinnati, which at first was just an engine to educate our community that too many babies were dying, because oftentimes in life you don't know of an issue unless it affects you personally. And so we needed to build that awareness. And we needed to tell people what they could do about it. And so Cradle Cincinnati really started with the safe sleep, the 3 S's, which is no smoking during pregnancy, spacing between pregnancies, and sleep. Thank you. And so this just started, it didn't start with programs. It started with education for the community and addressing some of the myths that people had wrong, like it's the parent's fault the baby died. Very rarely is it a parent's fault that the baby died, or it's genetic. More Black babies are dying because they're Black. Okay, well, race is a social construct, and so we need social solutions to address it. And then third, it was income, right? Oh, the poorest of the poor are having infant mortality. Well, did you know that a highly educated Black woman with commercial insurance has worse birth outcomes than a white person who drops out of high school and who has public insurance? So like something's in the water, right? And you have to address these things and acknowledge these things so you can build solutions. So you can build a solution like Mama Certified that says, we want local hospitals to pay more attention to how we're providing care to Black women. We need to revise our policies, because not every policy happens at the federal or state levels. There's local policy and there's internal policies that stand in the way of better showing up and improving health outcomes.
5 minutes.
Oh my gosh. All right. I just wanted to say policy is local. It's not just state. It's not just federal. It's local and it's internal. So what I do want to just say is advocacy was a key part of this. So we started a great example of listening to those who are closest to the problems, allows you to identify barriers that may have a policy solution. Not always. And when some people are sharing their barriers with you, they're not thinking about, oh, this is related to that policy and we need to change that policy. And so BI3 really leans into trust-based philanthropy, which means we have learning sessions and we just ask questions and we show up in ways to really support our grantees. And obstetricians shared with us that babies were losing their Medicaid, or women who acquired Medicaid coverage when they became pregnant were losing their coverage 60 days after they had a baby. How many of you have given birth and needed your doctor beyond 60 days? Right? I mean, to address postpartum depression and to treat chronic diseases and plan for future pregnancies. And so one thing about policy advocacy I've learned is that it's all about timing. And the federal government had offered that states could extend Medicaid coverage from 60 days to 1 year postpartum, but states had to turn it on. And so we partnered with Groundwork Ohio, and I don't know if some of you are still here, but they were today. There they are.
I was about to throw out
Hi,
shame.
friends. And they are a bipartisan coalition in Columbus. And we said, you're the experts. You know more about policy than I do. And we need your help. and they said, the time is right, let's do this. And so we partnered with an expert like Groundwork Ohio to help us push on the state and decision and policy makers to turn on the coverage. And so now in Ohio, moms have coverage 1 year postpartum. But, I come back to if we hadn't listened to the OB-GYNs and they hadn't brought this to at least our attention, I wouldn't even known that women were losing their coverage 60 days after. And so I think there's just power in those listening sessions. And I think too many times funders give grants and they're like, this is what we want you to achieve and you will achieve it. And then you miss all these opportunities along the way to shift and to flex dollars and to answer Meredith's call when she says, we're going to move $1 million to do this instead of this. And you say, okay, because that's what's needed.
Before we get cut off, because I know we're getting ready to get cut off, I just want to make one more point about this room and the goodness of this room. And
We're gonna do questions.
Oh, we're going to do questions.
Yeah,
Great.
okay, but go ahead.
The goodness of this room is connection. So I'm sitting at the table right over here where Kiana Trebu is sitting, and somebody who is wonderful and does dentistry of some kind. And we were talking about a study around dental health connecting to preterm birth that is happening at UC. Is that correct? Or at the health department? Somewhere in Cincinnati or Hamilton County. And I am thinking to myself, who knew? So they have a study that's going on where they're giving mouthwash to moms to see if that oral health connection to preterm birth is happening. And now I get to pick that information up and see what it looks like in Hamilton County, and then share that information with moms should it go well. So in this room, the celebration for me is that there are so many people doing so many great things that I want to talk to each and every one of you next time I will be on time and spend lunch at a better time. It's just such a great place to be, to find synergy and to lift. The All Teach, All Learn is a great time. So thank you. I'm ready for questions.
Well,
One last point, Amy. Okay, real quick. Okay, because I want to send this home, which is that it can't just be programs. Policy is so critically important, and it allows you to impact even more lives. Because through Cradle Cincinnati, we have saved over 220 babies and counting. That's 8 classrooms of kids, right?
Right.
By changing the policy to extend coverage from 1 year postpartum will impact 21,000 moms each year across the state. It's both. Mm-hmm. It's both.
Yep. Well, it's funny. The first question I was going to ask you was about a quote from the book, which was, "We cannot program our way out of wicked problems." And I was going to ask you, what do you mean by that? So you just answered it. Thank you. So we'll take a question or two from the audience. I do have a question just to get us started. So you talked a little bit ago at the beginning about experiencing maybe some backsliding that we hope is just a temporary blip. But, oftentimes changing wicked problems takes a long time. And it is very complicated. Lots of things need to change in order for those results to be achieved. So how do you maintain a sense of optimism and buy-in, from all of the people that you're interacting with, when things can take a long time, progress is not as quick as we'd like for it to be, and there may be backsliding?
I like to talk about wicked problems like a whack-a-mole. So there's a reality of we're hitting. So people who are choosing this job are prepared in ways of what that is. So I sort of say that in the interview, just so you know, there is no solving said problem. It is a reality of continuing to play this game. And when you're ready to tap out and move on, I understand. I also want to shout out my teammates who hold each other up. Meaning there are days when some people are like, I just cannot. So we had murders and terrible experiences, and you have to hold space for that. Take your time, and we will hold what you need at work until you are able to come back, and or come into the office and say what you need to say, whatever complaining you need to do, and then return to the work. So there's a space for holding. I also think, and how do you keep going, is that the advisory board and the community advisory board, the people who are committed to the work in Hamilton County, meet regularly, and we check on each other. So it's also a lot of celebration and a lot of praise, like even in the small wins. And additionally, when you look at your numbers every day, Dominique's not in this room who looks at our numbers every day, you can't do it. You've got to think longitudinally. Every year things go up and down and a little bit, and it's this race and it's, this small thing. And overarchingly, you have to remember that we are moving in the right direction. And so what are the things we are doing well? How do we increase those? What are the things we are not doing so well? And let's stop doing them. And being okay to stop doing things that we've been doing for however long if it's not working.
Okay.
I think, Amy, for me, it's getting an early win under your belt and it's setting some interim goals so that you can celebrate them as you achieve them, as you work to move the big needle, which takes years, if not decades, to change. So I remember being in the boardroom and we were almost 3 years in and we were focused in on Avondale because we started small and there was no movement in the infant mortality rate in Avondale. And the board was like, well, it's not working. We're not seeing the change. And you're not going to see change in big problems in 2 or 3 years. Like it's a community deciding this is going to be the issue and this is going to be the issue for 10 years. And we're all going to go at it and we're all going to pick ourselves up and we're all going to drive towards interim metrics and goals and we're going to celebrate those. So at the end of the grant period that funded Start Strong, which was a pilot in Avondale to deploy a new model of care that wrapped mom around with the support she needed. Avondale went from having an extreme preterm birth every 26 days to 0 for 3 straight years.
Wow.
That is a win.
Wow.
And no, we didn't touch the overall infant mortality rate in Hamilton County, right? Like Avondale changing and improving, reducing extreme preterm birth isn't going to move that needle. But it gave everybody hope that we were onto something good and what could we scale and start to create the movement that allowed us to get to a 5.5 infant mortality rate in 2023. So I think the celebrating wins are important. And you're going to have setbacks, but you keep going because like Meredith said, these aren't numbers you look at every day. I mean, those of you who are invested in the stock market, I hope don't look at your account every day because there's going to be some days where you're going to cry and some days but you look at it over the long term, right? It's the same thing with problems.
Great. Well, there was a question over here. Yes.
Yeah. Hello. I had a quick question about, you mentioned briefly when you were talking to the women involved in Queens Village that they really wanted to focus on healthcare and getting jobs in healthcare. I wanted to know the outcome of that. And then also, do you think that Black women getting more involved in healthcare also kind of solves one of the fears of Black women going into healthcare? Like if you see more people that look like you involved in your care, are you less likely to avoid that aspect of your prenatal care? If you could just talk a little bit more about that.
Yes, I will not throw out numbers because our epidemiologist will have my head. But I will say it was successful. And as I mentioned, many of the folks who started with us are still with us. I see them all over the city. Like, for example, Demita, who runs the hub in Hamilton County, she was one of the first board members of the Queens Village work. She has then since hired several people who are in the Queens Village work. So I think the network in general has been helpful. And because you are doing what they asked you to do, it sort of fills out. The second part of your question was around, tell me again. But I hear you.
She wanted to know, like, have the women entered into healthcare careers?
So yes, that is the answer to that. But there was a second part. What was it?
If you think that intrinsically improves your...
Oh, right. So do people want to have caregivers who look like them? Absolutely. They ask that question all of the time, particularly in mental health. So there are funders who are supporting pipeline work. There are funders who are supporting mentorships. We have people in the community who are doing lay spaces to hold space for mental health people until we can get people who look like them. That is the case for across the board. Also, the work of bringing providers to Queens Village who don't look like them to say, hey, let's get in relationship. It isn't necessarily that I don't look like you. It is that we have not created a relationship and the narrative is terrible. And so partly sharing story, building trust, some of the stuff we talked about earlier can also bridge that divide.
Thank you.
So I recall that when we first went into Avondale, and let me say, you don't just walk in and start knocking on doors and be like, hey, how's your birthing experience? You really identify the allies in that community that the people trust, whether that's the pastor or whether that's a community health worker. Like that's where you start with your allies that can help you build trust, right? And so the Black women of Avondale said, we want to meet with some of the providers because we have this great mistrust. And the only way we're going to start to tackle that is by meeting with them and developing a relationship, as Meredith said. So providers, obstetricians were asked to have dinner with Black women in Avondale. Physicians were pumped, like, we're going to educate moms on the importance of early prenatal care. And they started in, and the women were like, time out. Like, we don't want you to educate us. We want to get to know you on a human level. And so fast forward a few months later, true story, I promise. A woman is at TriHealth getting ready to deliver her baby, and Dr. Mike Marcotte walks in, who is a white male, into the room, and he meets this woman's face. And he said, immediately when she recognized me, the stress on her face started to dissipate. And she said, I know you. We had dinner together a few months ago. And he said that just put her at ease and made her feel like she trusted him, right? They had a conversation and they started to build a relationship, and he happened to be the one who walked in, so it doesn't matter.
Mm-hmm. Mike's also awesome.
All right. Well, on that note, I'm so sorry. We do need to wrap up. If there was another question. Thank you. Please join me in thanking Dr. Smith and Jill. Well, thank you again for being here today. Please take a second to complete your evaluation form for the plenary sessions and then the overall summit. I think there's a QR code up there. Yes, there is. All right, if you're here for CLE, I have your activity code. Y'all ready? It's 597335. 597335. Okay, I think Alana, we're going to do the raffle. You have to be present to win. So here we come with the raffle for Dr. Smith and Jill's book. We hope you've come away with a few pieces of knowledge that you didn't have when you came in, tools that you can use as you move forward. We appreciate, again, you being here today and your partnership and your support of one another. So thank you so much. Alana?
I'm going to give you these. Oh, okay. You can run those around.
Oh, okay.
All right. First, I just want to thank everybody for being here today. My name is Alana Clark-Kirk, and I am the Director of Communications and Engagement at HPIO. If you got an email about this event, it probably came from me. Thank you for reading it if you read the entire thing, because they're usually pretty long. I also want to thank our staff and our team for all of their help getting us ready for today. I also want to thank our advisory group who helped us select the breakout sessions and workshops for today. I want to thank all of our speakers for being here and doing such a great job. I've heard a lot of positive feedback as well. And I also want to thank our sponsors for their contributions so that we could host this event today. With that, I will call some raffle tickets. All right. If you have 119206, raise your hand. Amy will bring you a book. I'm going to keep calling them off because I know some of us want to get out of here. 119030. Woohoo! Got a winner. 119189. Nope. 119191. 189, yeah. Winner. Okay, so that's two. We've got three left. 119029. Over there in the back. 119302. Woo! Thanks for sticking it out. It worked. It paid off. You got a book. Is that 4 or is that 3? Somebody tell me. Where are we at? We're at 4. Okay. 119193. Nope. 119199. Winner, winner. All right. If you really, really, really wanted a book but didn't get one, come talk to me.